Hi class, my name is Jennifer Paul. I go by Jenny. I've been a nurse for almost 15 years. It'll be 15 years in May. Currently, I'm employed in Tyler, Texas at the Lewis and Peaches Owen Heart Hospital for Christus Trinity Mother Francis. I've worked there for about 17 years, not all of that as a nurse. I started out low on the totem pole as a sitter while I was in nursing school, and then started working as an extern on the unit that I would later become a nurse, which was a telemetry unit. After telemetry, after I got kind of tired of that, I was asked to work on a step-down open heart unit, which I loved for several years, charged that unit as well, charged the telemetry unit as well. When that got kind of old, I ended up working on a vascular surgery unit, and also it was vascular surgery / cardiac observation. Right now, I currently work in the CVICU as a registered nurse. I'm a pre-op nurse. Our pre-op setup is a little bit different than most. Most patients go to pre-op for surgery, and then they have their surgery, come back to the room after they're recovered. Our pre-op is a little bit different. For our cardiac surgeries, they want to make it an experience. So they come to the room that they're actually going to come back to after surgery. I pre-op them, answer any questions beforehand. They go to surgery, and then instead of going to recovery, they come directly back to the room to be recovered by a certified recovery nurse, which I am not. I just get you ready beforehand. So far, this is the role that I've loved. The hours are great, 4:30 to 1 p.m. most days. Some days I'm a little bit later, but it helps out with school. I have 2 teenage daughters, one that's about to graduate this year, and then another one that will be a senior next year that's involved in a lot of after-school activities. So this job, the hours have helped. I think one of the most challenging roles that I've ever been in was charging, and it was charging on the cardiac observation unit. The turnover with patients was very high. It was designed to rule out anything if you came in with chest pain. Cardiac enzymes were done. If those came back negative, a stress test was done. The stress test was negative, you went home. So in the course of a day, we could have anywhere between 3 and 4 patients in just one bed assignment. So for a nurse who's carrying a patient load of 5 patients, they get tired very easy and get frustrated with you because you keep giving them patient after patient after patient when that bed is empty. So essentially they don't get much of a break. That was probably the hardest role, just with stress and hearing everybody complain and trying to keep morale up. One of the things on my bucket list, I think, is getting a job traveling. And several years ago, I guess it was probably about 10 years ago, I actually had a travel assignment for Hawaii. Had gone on vacation, fallen in love, looked for job opportunities, and decided to travel. At that time, I wasn't married, didn't have any kids, but found out a few weeks before I was supposed to leave that my grandfather had lung cancer, and he begged me not to go on his deathbed. So I never ended up going. A few years later, got married, and then my wonderful husband had children, so I became a mother, and that kind of dashed that idea. But I think traveling is one of my biggest bucket list items. The other thing I'd like to do is continue my education and receive my master's degree, and I think teaching. Bedside nursing gets really old after a while, and I'm enjoying the easier position I have now, which is a lot more conducive for my schedule. But I think teaching ultimately is another one of my big bucket list goals. So hopefully, once I finish my bachelor's degree, I'll move on to my master's to be able to teach. But that's just a little bit about me. I can't wait to hear about everybody else, and it'll be a fun ride. See you later, guys. Bye-bye.